Hey there, listeners. Welcome back. We love to get deep in the weeds on healthcare policy here, and today we're tackling a big one, Idaho's Medicaid program, and some proposed changes that have a lot of folks talking.
That's right.
So we had a bunch of you reach out wanting to understand House Bill 345.
HB345.
Right, HB 345, and what it could mean for, well, how people in Idaho get the healthcare they need. It's not just some dry policy document. This has real-world implications.
Yeah.
Yeah.
We're talking potential changes to, who even qualifies for Medicaid, what treatments are covered, even how decisions about Idaho's Medicaid program are made in the future. That's a big one.
Okay, yeah, I'm already sensing this is way bigger than just like tweaking a few rules here and there. What jumped out at you as the biggest potential impact from all the stuff we've been reading through?
Well, one thing that really struck me is this potential shift in decision-making power. Right now, it's mainly the executive branch. So the governor's office, state agencies, they're the ones calling the shots. But this bill could give a lot more power to the legislative branch, to lawmakers.
Hold on. So instead of like healthcare experts making decisions about Medicaid, we could have politicians deciding things. I mean, what could that mean for people who depend on Medicaid?
Well, that's a huge question. Some people are worried that it would mean decisions are driven more by politics, by agendas, than what's best for patients and doctors.
Right.
This idea of the politicization of healthcare. It's a big concern. You can imagine, right? Healthcare decisions becoming like bargaining chips in political negotiations.
That's, a little unsettling, to put it mildly.
Yeah.
So if lawmakers are making more decisions, wouldn't that affect like what treatments Medicaid actually covers?
Potentially, yes. And that's where some specific concerns come up. The stuff we've been looking at, it points to gender-affirming care as one area that could be targeted for cuts, or more restrictions under this new setup.
Wow. So we're not just talking about some abstract policy stuff here. These are people's lives we're talking about.
Exactly. Real consequences. Another big worry is what this could do to rural healthcare. Rural hospitals and clinics, they're already facing all kinds of challenges, right? And these changes to Medicaid funding, eligibility, it could put even more strain on them, maybe even force some to close.
And that just hits folks in rural areas twice as hard, right? I mean, they already have fewer options for healthcare. This bill could make it even tougher to get the care they need.
Exactly.
Yeah.
And it's not just rural areas either. The changes they're talking about for eligibility, those could affect a lot of people across Idaho. Think about it. Raising the income limit to qualify or adding more bureaucratic hurdles to even apply.
So even if you qualify for Medicaid now, these changes could knock you off the program. It's possible, yeah. And for people who would be newly eligible, those extra hurdles, they could make it much harder to enroll in the first place.
It's starting to feel like this bill could create this ripple effect, like through Idaho's whole healthcare system.
I think that's a good way to put it. And it's important to keep in mind that this is all part of a bigger conversation. This is happening all over the country. The role of government in healthcare, how to balance costs with access to care. It's a tough one.
So Idaho's not alone in trying to figure out what the future of healthcare looks like. But what does it mean for our listener, right now? What should they be watching for as this bill moves forward?
Well, the source material highlights March 10th. That's when the Senate Health and Welfare Committee is holding a public hearing. That's a big deal. It's a chance for people in Idaho to tell their elected officials what they think, what their concerns are. So this is where our listener can actually do something. This is like civic duty in action, right? Tell me more about what happens at a public hearing. Like, what should they expect if they decide to go?
Basically, it's a forum. Citizens can speak directly to their lawmakers, share their opinions, their worries, anything. It's a way to make these policy discussions, which can feel very abstract, make them more personal, more real.
So it's not just about showing up and saying, I'm for this or I'm against that. It's about explaining why this matters to you, helping those lawmakers understand how their decisions actually affect people's lives.
Exactly. And being prepared is key. The materials we read, they really encourage people to familiarize themselves with the details of HB 345, so that they can talk about the specific parts they find concerning.
All right, listener, time to hit the books. Sounds like doing your homework on HB 345 is essential if you want to make your voice heard at that public hearing.
For sure. But even if you can't be there in person, there are other ways to engage. You can always contact your state senators and representatives directly, emails, phone calls, even letters.
Don't underestimate the power of a well-written letter. And of course, we live in a digital age, so spreading the word on social media, that can help raise awareness too, right?
Absolutely. The more people who understand what's going on, what's at stake, and get involved, the better chance we have of creating a healthcare system that works for everyone in Idaho.
Couldn't agree more. We've covered a lot already, but we're just getting started. What else should our listener know about what's actually being proposed in this bill?
One key area we haven't really dug into yet is potential cuts to services. We talked about eligibility changes, but HB 345, it also proposes some pretty significant reductions in what Medicaid would actually cover.
So even if you manage to qualify under the new rules, you might not have access to all the same services as before.
That's right. And this is where things get really, really heated. There are valid concerns that these cuts, they can mean cutting essential services, and that could seriously hurt the health and well-being of people who rely on Medicaid.
So it's like this balancing act, trying to be fiscally responsible, but also making sure people can get the care they need.
That's the heart of it, and that's why it's so important to have this conversation, a real conversation about what this bill means.
Definitely. Before we go any deeper into those specific cuts, I think it might be helpful to take a step back for a minute and look at, the history of Medicaid in Idaho. Like, understanding how we got to this point, I think it could help us see where things might be headed.
I agree. Context is so important. Let's take a little detour into the past before we jump back into the potential future of Medicaid in Idaho. Welcome back. Before we got sidetracked, we were talking about House Bill 345 and its potential impact on Idaho's Medicaid program. We were saying it's important to understand the historical context, right?
Right, because to figure out where we're going, it helps to know how we got here. So can you give us like a crash course on Medicaid in Idaho? How has it evolved over the years?
Sure. Most people probably know that Medicaid is a joint federal and state program. It provides health care coverage to people with low incomes, individuals, and families. It's been around for a long time, and like a lot of government programs, it's gone through changes over time. It's had to adapt.
So what were some of the big turning points in Idaho? What shaped the program into what it is today?
Well, Idaho first adopted Medicaid back in 1966. It was pretty soon after the federal program was created. And back then, eligibility was pretty limited. It was mostly for pregnant women, children, and people with disabilities.
It was much smaller and more focused than it is now.
Oh, yeah, much smaller. But over time, Idaho, like many states, started expanding Medicaid eligibility to cover more people. And a lot of that was driven by changes in federal law, like the Affordable Care Act, that really encouraged states to expand coverage to adults without kids.
So there's always been this back and forth between the state and the feds when it comes to controlling Medicaid. And this new bill, it seems like it's pushing for more state control, right?
That's one way to see it, yeah. This proposed shift in decision-making power that we talked about, taking it away from the executive branch and giving it to the legislature, that would be a huge change in how Idaho manages Medicaid. It raises a lot of questions about how much autonomy states should have versus federal oversight, especially when it comes to healthcare policy.
It seems like HB 345 is really putting those tensions front and center. Okay, before we get too lost in the political weeds here, let's get back to those potential cuts in services that we mentioned earlier. What could actually end up on the chopping block if this bill passes?
Well, the details are still being debated, but some of the services that could be cut include dental care, vision care, and non-emergency transportation.
And those are pretty essential services for a lot of people, especially folks with limited incomes. They might not be able to afford those things on their own.
Exactly. And remember, we're also talking about possible restrictions on gender-affirming care. As we discussed earlier, that could have a huge impact on transgender Idahoans who depend on Medicaid for their health care.
It sounds like these cuts could really hurt people. But I know there's another side to this argument. Some people say these changes are necessary to be fiscally responsible, right? What's their logic?
People who support HB 345, they argue that Idaho's Medicaid program is just getting too expensive. It's not sustainable in its current form. So they see these cuts as a way to control spending and make sure the program can survive in the long run.
So it's the we need to tighten our belts argument. But how do they justify cutting services that so many people rely on?
Well, one of their main points is that Idaho's Medicaid program has just gotten too big. It covers too much. They think it needs to be streamlined, refocused on its core mission, which is to provide essential health care to those who really, truly need it.
So they're saying Medicaid has become too generous maybe and it needs to be scaled back?
That's one way to interpret it, yeah. They also argue that the current system discourages people from working and becoming self-sufficient, because if they make too much money, they might lose their Medicaid coverage.
It's the classic debate about government assistance. Does it create dependency or is it a necessary safety net?
Exactly. And it's really hard to say. There are good points on both sides. It's a very complicated issue.
This bill is really forcing people in Idaho to face some hard choices about what kind of healthcare system we want and how we're going to pay for it.
That's exactly right. And that's why this public hearing on March 10th is so important. It's a chance for people to share their views, to voice their concerns, and to really help shape the future of healthcare in Idaho.
It's a chance to remind those lawmakers that behind every policy decision, there are real people whose lives are being affected.
That's so true. And remember, it's not just about being at the hearing. It's about staying informed, being part of the conversation, and speaking up for the kind of healthcare system you believe in.
Speaking of conversation, I'm wondering, are there any alternative solutions being proposed? Like, are there other ways to address the cost concerns without making such drastic cuts in services?
That's a great question. And yes, there are. There are people talking about other approaches. Some are pushing for more efficiency and transparency in the Medicaid program, cutting down on administrative costs, eliminating waste. Others are saying we should explore new ways of delivering healthcare, like telehealth, which could save money without sacrificing the quality of care.
So maybe there's a middle ground here, a way to save money without taking away essential services from people who need them.
That's what a lot of people are hoping for. And this brings us to another really important point. This debate about Medicaid in Idaho, it's not happening in isolation. It's part of a much bigger national conversation about the future of healthcare in America.
We touched on that earlier, but I think it's worth repeating. How do the challenges facing Idaho's Medicaid program connect to the bigger picture?
Well, all over the country, states are struggling with rising healthcare costs. They're dealing with aging populations. And there's this ongoing debate about what the government's role should be in providing healthcare.
Sounds familiar. So Idaho's problems with Medicaid are basically a microcosm of what's happening with healthcare nationwide.
Exactly. And the decisions made here in Idaho, as well as in other states, they'll have an impact on the whole country. They're going to shape the future of healthcare for all Americans.
It's a good reminder that healthcare policy isn't just about numbers and politics. It's about real people, their health, and whether they can get the care they need.
That's it. And that's why it's so important for each of us to engage in this debate, to understand what's at stake, and to push for solutions that are compassionate, equitable, and that guarantee access to quality healthcare for everyone.
I like that. As we get deeper into this conversation, I keep thinking about how important it is to understand all the different points of view. We've talked about the arguments for and against HB345, but I'm really interested in hearing from the people who would be most affected by these changes.
I agree. It's so important to hear from the people who rely on Medicaid, the healthcare workers, and really anyone who has a stake in the future of healthcare in Idaho. Their stories, their experiences, those give us really valuable insights into how these policy decisions would play out in the real world.
Let's shift gears a bit and explore those perspectives. We're back, and we've been spending this episode really digging into Idaho's House Bill 345, looking at the potential impacts on Medicaid. We've talked about the proposed changes, we've gone over the arguments for and against it, the historical context even. But as we keep saying, this is about more than just numbers on a page or policies, right? This is about people.
Absolutely. To really understand what HB 345 could mean, we need to hear from the people who would actually be affected by these changes. We reached out to some Idahoans, and I think their perspectives really highlight the human side of this whole debate.
Let's hear those voices. What are people saying about how this could change their lives?
Well, one woman we talked to, she's a single mom, working part-time, raising 2 kids. She relies on Medicaid to cover their health care. And she's really worried that the proposed changes to eligibility, the income limits, could mean her family loses coverage. She's already struggling to get by as it is, and the thought of having to pay for health care out of pocket, it's incredibly stressful for her.
Yeah, it's a good reminder that for a lot of families, Medicaid is a lifeline. It's not just some government program. It's what allows them to take their kids to the doctor.
Exactly. And we also spoke to an older gentleman. He's a senior citizen who depends on Medicaid to help him afford his prescription drugs. He's really concerned about the potential cuts to the pharmacy benefits. He's on a fixed income, and having to choose between his medication and other necessities like food or rent, that's That's a scary thought.
It's awful. It sounds like this bill could really put some seniors in impossible situations.
Yeah, it's a big worry. We also heard from a healthcare provider. She works at a rural clinic, and she's concerned about how HB 345 could impact access to healthcare in rural areas. She sees every day how stretched thin resources are, and she worries that these changes, the funding cuts, could force her clinic to close its doors. And then what happens to the people in her community? A lot of them would have nowhere to go for care.
So this bill could actually make the problems facing rural healthcare even worse.
Yeah, that's a real concern. And these are just a few examples. We've heard so many personal stories like this, and they really emphasize how important it is to think about the human impact of policy decisions.
These stories are a good reminder that this isn't some theoretical discussion. These changes could have a huge effect on people's lives, their health, their well-being.
I agree, and it highlights the importance of approaching this issue with compassion and understanding. It's complicated.
And it reminds us that there's more than one side to this story. There are many different perspectives and experiences to consider.
That's right, and those voices need to be heard. And that's why the public hearing on March 10th is so important. It's a chance for people to share their stories directly with their elected officials and try to influence the outcome of this debate.
So this is where our listener, you, can actually make a difference. Even if you don't personally rely on Medicaid, you can show up, listen to these stories, help amplify those voices that might not otherwise get heard.
I agree. And remember, being a good citizen doesn't stop at the public hearing. Stay informed, stay engaged, and keep speaking up for the kind of healthcare system you believe in.
It's easy to feel overwhelmed by all this, the complexity of healthcare policy, but we all have a role to play.
Absolutely. And the first step is to care, to listen, to try to understand.
Well said. Well, we've covered a lot of ground today, haven't we? We've looked at the proposed changes, the arguments for and against, the history of Medicaid in Idaho, and most importantly, the very real human stories at the heart of this whole debate.
And we've talked about how important it is to be involved, how powerful individual voices can be when it comes to shaping the future of healthcare.
I hope you found this episode informative and thought-provoking, maybe even a little inspiring.
This is an ongoing conversation. Keep learning, keep asking questions, keep fighting for the kind of healthcare system you believe in.
And as we wrap up today, we wanted to leave you with one final thought. If healthcare is truly a fundamental human right, how do we, as a society, make sure that right is guaranteed for everyone?
That's something to think about. It challenges us to look beyond our own individual needs and consider the well-being of our entire community.
Thanks for joining us on this deep dive. Until next time, keep learning, keep questioning, and keep working towards a better future.